Welcome to our channel. Today we're diving into the fascinating world of placebo controls and their impact on chronic disease management. We'll uncover the science behind the placebo effect, how it's used in research, and the ethical considerations surrounding it. This isn't just about pills and procedures, it's about understanding the profound connection between your mind and body. Let's get started. Have you ever heard someone say, "It's all in your head"? Well, when it comes to the placebo effect, there's actually some truth to that. The placebo effect is a real, measurable phenomenon where a person experiences a benefit after receiving a treatment that has no inherent therapeutic value. Imagine you have a headache, and you take a sugar pill believing it's a powerful pain reliever. Surprisingly, your headache disappears. That's the placebo effect in action. It's not about faking it. It's about your brain's incredible ability to influence your physical experience. This effect is particularly relevant in chronic diseases, where the experience of symptoms can be subjective and influenced by a complex interplay of physical and psychological factors. Studies have shown that placebo treatments can lead to improvements in mood, anxiety, and overall quality of life. Our brains are capable of generating real, tangible changes in response to our beliefs and expectations. So, while the placebo effect might seem mysterious, it underscores a fundamental aspect of healthcare, the power of the mind in healing. How do we know if a new treatment is actually working or if it's just the placebo effect? That's where clinical trials come in. In these trials, researchers use placebos as a control group to determine the true effectiveness of a new drug or intervention. Let's imagine we're testing a new drug for chronic pain. We divide participants into two groups. One group receives the actual drug, while the other group receives a placebo. Importantly, neither the participants nor the researchers know who's getting the real drug and who's getting the placebo. This is called a double-blind study. Why is this important? It helps to eliminate bias. If participants know they're receiving the real treatment, their expectations might influence their experience of symptoms. Similarly, if researchers know who's getting the real drug, they might unintentionally interpret the results in favor of the treatment group. By using a placebo control, researchers can isolate the specific effect of the drug from the overall improvement observed in the treatment group. Placebo-controlled trials are the gold standard for medical research because they help ensure that new treatments are not only effective, but also safe and worth prescribing to patients. So how does the placebo effect actually work? One key player is expectation. When we believe that a treatment will work, our brains release endorphins, which are natural pain relievers and mood boosters. This expectation can be influenced by a variety of factors, including the doctor's confidence in the treatment, the way the treatment is delivered, and even the color of the pill. The placebo effect can modulate the activity of specific brain regions involved in processing pain, emotions, and reward. Studies using brain imaging techniques have shown that when people believe they are receiving pain relief from a placebo, there's decreased activity in areas of the brain associated with pain perception. Interestingly, the placebo effect isn't just about fooling ourselves, it taps into our brain's innate healing mechanisms. Our bodies have a natural capacity for self-repair, and the placebo effect might be a way to tap into that potential. By understanding the psychological and neurological underpinnings of the placebo effect, we can start to harness its power to improve healthcare and enhance well-being. Let's dive deeper into one of the most intriguing aspects of the placebo effect, the power of expectations. If you walk into a doctor's office expecting a treatment to work, you're more likely to experience a benefit than if you walk in feeling skeptical or pessimistic. Our expectations can actually influence our physiological responses. Studies have shown that when people believe they are receiving a pain-relieving cream, their brains release more endorphins, even if the cream is actually inactive. When we believe in the potential of a treatment, we create a self-fulfilling prophecy. Our brains and bodies respond accordingly, increasing the likelihood of a positive outcome. A doctor who takes the time to listen to their patients, explain treatment options clearly, and instill hope and confidence can significantly enhance the placebo response. It's not just about the pills or procedures, it's about the power of human connection and the belief in the possibility of healing. How can we use our understanding of the placebo effect to design better treatments for chronic diseases? It's about optimizing existing treatments and developing new ones that leverage the mind-body connection. Imagine if we could create treatments that not only target the physical symptoms of a disease, but also enhance the placebo response. This could lead to more effective pain management, improved mood, and a better quality of life for patients with chronic conditions. One way to do this is by paying attention to the way treatments are delivered. Studies have shown that the more elaborate and ritualistic a treatment is, the stronger the placebo effect. Another approach is to incorporate elements of mind-body therapies, such as meditation, yoga, or acupuncture, into conventional medical treatments. By understanding the factors that influence the placebo response, we can design more effective and holistic treatment plans that address both the physical and psychological aspects of chronic diseases. The placebo effect raises important ethical considerations. Can we ethically prescribe a treatment that we know has no inherent therapeutic value, even if it might make the patient feel better? This is a complex issue with no easy answers. Some argue that using placebos is deceptive and undermines trust between doctors and patients. Others argue that if a placebo can alleviate suffering, it's ethically justifiable, especially in cases where conventional treatments have failed. One important aspect of ethical placebo use is informed consent. Patients have the right to know what treatments they are receiving and to understand the potential risks and benefits. If a placebo is being used, it should be done openly and transparently, with the patient's full knowledge and consent. Ultimately, the ethical use of placebos requires careful consideration, open communication, and a deep respect for the patient's autonomy and well-being. How can we apply our knowledge of the placebo effect to improve the lives of people living with chronic diseases? It starts with recognizing that chronic disease management is not just about treating symptoms, it's about empowering patients to take an active role in their health. By understanding the power of the mind-body connection, patients can develop coping mechanisms, manage stress, and improve their overall quality of life. Practices like meditation and yoga have been shown to reduce stress, improve sleep, and alleviate symptoms of chronic pain, anxiety, and depression. These practices can be integrated into existing treatment plans to enhance their effectiveness and empower patients to manage their symptoms more effectively. Another important aspect is fostering a strong therapeutic alliance between patients and healthcare providers. When patients feel heard, understood, and supported, they are more likely to adhere to treatment plans and experience positive outcomes. This involves open communication, shared decision-making, and a focus on the patient's individual needs and values. By embracing the principles of patient-centered care and harnessing the power of the placebo effect, we can create a more compassionate and effective healthcare system for all. Thanks for watching. If you found this video informative, don't forget to like, share, and subscribe for more insights into health and wellness. We've covered a lot of ground today, from the science behind the placebo effect to its ethical implications. But the key takeaway is this: your mind and body are powerful allies in the journey to health and well-being. By understanding the placebo effect, we can start to harness its potential to improve healthcare, enhance treatment outcomes, and empower patients to take charge of their health.